Dear colleagues and friends, it has been a substantial venture with the journal for 5 years. It was my honor and great pleasure to work with all the wonderful people around the world. I'd like to give my gratitude to all the friends which I met through the journal with my final video introduction. I also like to give my deepest appreciation to all the help by Gary, Jim, Hank, Matt, Leslie, but not least Deborah. I'm sure this will be a closing of one session, but opening of another with our friendship and collaboration. In this month's issue, in accordance with the editorial, one of the most interesting and maybe controversial article in this month would be the effect of insertion angle on the pull-out strengths of threaded suture anchors, a validation of the dead man theory, by Clevenger and others. Many orthopedic and medical theories have been challenged by following subsequent studies in the past. This study shows how level 5 study or evidence, which was thought that it was truth at the time, can be challenged after a certain period of time. I feel medicine is a dynamic field of science, and we need a continuous high-level studies to back up what has been claimed by experts. This article raised much controversy on the proper insertion angle for anchors in shoulder surgeons, or even any other surgeries using anchors. I feel this article needs further studies to reproduce or back up their findings. However, I appreciate their effort to test the theories of what has been considered truth by others. In this month, also, the article by David Bologna and Sean O'Driscoll introduced an excellent article on elbow arthroscopy. They performed large volume arthroscopic elbow contracture release and report the complication of delayed onset ulnar neuritis after the procedure. They found that its incidence and severity can be reduced by limited open ulnar nerve decompression or transposition prior to the procedure. They compared large number in both groups, more than 200 cases in each arm. I feel this study will help those who are going to perform arthroscopic elbow contracture release. I'd like to also introduce one of my colleague paper looking at the arthroscopic Bankart repair in more than 20% glenoid bone defect. I found that this paper is also controversial since currently there is a general consensus that having more than 20% of bone loss in the glenoid can have a high failure rate after arthroscopic Bankart repair. They had a relatively good result with relatively small sample size. This paper gives a message that low to moderate functional demand without joint laxity can have a relatively good result with arthroscopic procedure. However, it should be taken account that this is very narrow indication with substantial bone loss. More young and high demand patients with a predominant population in the instability group should be taken into consideration for more failure rate than the authors report. There are many other excellent original articles which you should not miss out due to the time limit here. There are several systematic reviews, a meta-analysis in this month, which some conclusion of their conclusion shows that there are still much lack of evidence in what we do on a daily basis. I hope you enjoy August issue, and once again, it was my honor and pleasure to work with the Journal of Arthroscopy. Thank you very much.